Good evening, everyone.
Good evening.
Good evening.
On behalf of International Homeopathic Foundation, I, Dr. Amita Arora, welcome you all once again on this online platform. And आज का टॉपिक बहुत ही इंटरेस्टिंग होने वाला है, डिस्कशन बहुत इंटरेस्टिंग होने वाली है. So we all are waiting for our experts to give their comments. Before that, I just want to introduce International Homeopathic Foundation to those who are new with us. The International Homeopathic Foundation was founded in the year 2015, which aims to promote homeopathy through academics and integrated approach. Since inception, we have organized various free health camps, seminars, homeopathic medical education series. The most talked about 3-day successful International Homeopathic Congress was organized at Tathivanta, Dwarka in April 2016, where more than 250 doctors, researchers participated globally. We have also proposed credit system for homeopathic doctors to Ayush department, which is in process, and we can soon get a good news about the credit system for doctors. Virtual international homeopathic summits and mega panel discussions were organized during the COVID time, and our eminent speakers included homeopaths, allopaths, dietitian, yoga specialists, and people from research from CCRH. Dr. Muktinder Singh, Dr. Tarkeshwar Jain, Dr. Bajrang Bhosle, Dr. B.D. Patil, Dr. Ajit Kulkarni, Dr. Harsh Nigam sir, Dr. Anil Khurana, Dr. Harleen, and the list continues with Dr. Jaswant Patil, Dr. Arvind Kumar, Dr. Hemant Madan, dietitian Pallavi, Dr. K.S. Virar, and many more speakers. IHF has also organized joint webinars with Lung Care Foundation to create awareness in society against increasing pollution and its harmful effects. Recently, we celebrated our 268th birth anniversary of Dr. Samuel Henneman in collaboration with Baxen's Homeopathic Medical College on 2nd of April 2023 with one-day mega conference. So today's topic of panel discussion is misuse of social media against homeopathy. So why this topic? First of all, अगर हम पिछले कुछ महीनों में देखें and COVID time से हम देख रहे हैं कि कहीं ना कहीं होम्योपैथी पे बहुत ज्यादा सोशल मीडिया के अटैक्स होने शुरू हो गए हैं. We have seen that one of the journalists has also taken a long debate on homeopathy, against homeopathy in fact, and they tried to prove that it is the most harmful medical science. So today we want a very healthy discussion about pros and cons and everything about homeopathy, an eye-opener session for everybody who will be our audience today. So we will be recording this session and it will also go on the YouTube channel of International Homeopathic Foundation. Before that, I want to show you something that why we have selected this topic. Today's expert panelists include Dr. Pinakin Trivedi, who is the President, Board of Ethics and Registrar of Homeopathy, National Council of Homeopathy. Dr. J.D.Daryani, who has a lot of experience of 50 years, and he is former Principal and Medical Superintendent, Dr. M.P.K. Homeopathic Medical College and Hospital, Jaipur. Dr. Harsh Nigam. See, we have invited these doctors who are qualified doctors, experienced doctors who are MBBS, MD, and they are also practicing homeopathy. So it will definitely not be a one-sided session. It will be a sided session, an eye-opener session. Again, I repeat that. Dr. Jaswant Patil, sir, who is MBBS, MD expert in cardiology and he has 35 years of experience and he is an integrated practitioner. Dr. Mehta, who is a palliative care physician. So moving forward, I just want to show you this slide where it is all against homeopathy. I will not be taking you with a long session on these slides, but it is just a glimpse of it. I will be forwarding you the links on the chat box. So when you will click on the links, you can read that. So we will not waste time on this. I just want to show you that these are the social media articles where we will be discussing everything today. So the homeopathic remedies related to severe drug-induced liver injury, we will be discussing that. See, this is all is being written against homeopathy. A famous journalist held a very long debate on this, and it was like कि yes, होम्योपैथी जो है वो सबका बुरा कर रही है, होम्योपैथी से लिवर खराब हो रहे हैं, होम्योपैथी जो है वो बहुत हार्मफुल मेडिकल साइंस है. Let's see what our experts have to say today. So moving forward, I request Dr. Wahi sir to please take the questions and he can definitely put the questions to the expert he feels. We have Dr. Pinakin now with us. We have Dr. J.D.Daryani sir also with us. So in the order of this, you can take that, sir.
Okay.
So I'll just unmute our respected expert speakers.
Okay, so I will proceed straight away with the questions which you have proposed. And Dr. Amit, I hope you have sent these questions to the panelists.
Yes, sir. Yes, sir. I have.
Okay. So the very first question is, Dr. Pinakin, please comment on it and followed by others. In your view, what could be the possible causes for the anti-homeopathy propaganda against homeopathy?
Dr. Pinakin, sir, you can unmute yourself, please. So you can unmute yourself.
If you mute again, then it doesn't get unmuted.
It's okay.
Welcome, Dr. Pinakin, sir.
Sorry, I was late. I was busy
No
with some-
problem, sir. We also welcome Dr. Daryani, sir.
Namaskar,
Dr.
sir.
Dr. Daryani, sir, has also joined.
I'm Daryani,
Dr.
sir.
Daryani, you can also unmute yourself, sir.
So, Dr. Trivedi ji, now, first question I have already read. In your view, what could be the possible causes for the anti-homeopathy propaganda?
Sir, nothing but it's a human nature. So the people, the either all those who are criticizing homeopathy may be having certain problems with homeopathy, or for this pharmaceutical lobby may be behind that. So everywhere the reason may be different. In Kerala, it is just a competition of allopaths with this our system of medicine. And internationally, what we can assume that maybe some pharmaceutical lobby which may be preventing the developing or spreading of homeopathy. That's what I think.
Dr. Nigam ji, so what are your views about that?
Thank you, sir. सबसे पहले तो आपको प्रणाम, दरयानी सर को भी प्रणाम. The real cause since homeopathy's inception has been, number one, improper and not a proper understanding of homeopathy per se. Then fear of having a very staunch opponent to the modern medicine. The mainstay of medicine, the classical modern medicine, has always been afraid of some other kind of therapy rising up against them. And since we know that homeopathy is the second largest therapy that has been all over the world, which has been followed, now the use of homeopathy is shrinking. Why? Because there are two faults. One is the fault, which is the fault of our own system, because we are not united, number one, because we do not present proper evidence, number two, number three, we don't take these assaults seriously. Now, these assaults are not only by the scientific world, but big pharma. The big pharma is against us, and we would have to stand up somehow against this kind of assault. What are the remedial measures we can discuss later, but it is a threat perception of homeopathy by the modern classical medicine, modern medicine, and big pharma, which is basically the cause of these kind of assault since the beginning, since Hahnemann's days till now. It is this threat perception which is causing this problem.
At times, I mean, I've been feeling that as homeopaths, we have inherited this situation because it has been right from the time of Dr. Hahnemann. Coming to Dr. Patil, Dr. Patil, you yourself have been a strong opponent of homeopathy, as you have said many times on the platform. And at the same time, when you experienced it in your own family, on yourself, etc., your perception changed, and in fact, you had a big hospital with MD, with the large number of indoor patients as well as, and I think you have gradually reduced everything, and now your focus is much more on the OPD patients, wherein you are able to provide good services to the patients. So, regarding this controversy, what are your views?
Good evening, everyone. First of all, we should be happy that we are being criticized. Because when criticism comes only when you rise high. And the criticism had started earlier also from the day of inception of homeopathy, because it was a division of one family, two brothers, one allopathy and one homeopathy. And we should not fight for that, because every science has got its scope and limitations and strengths are there. But if you see the history, during the cholera time, when homeopathy has done wonders in saving the lives, the hands were not bound, and many patients have been saved from there. The upliftment of homeopathy started. And then finally, it was coming up. Now almost 40% people are diverted towards homeopathy because of its good results. Now, second point comes into the COVID. Again, in COVID time, the arsenical was the highest maximum distributed medicine of homeopathy. Therefore, there are a lot of controversies. Arsenic is a poison. Yeah, it's a poison. But when homeopathic medicines are made, it is so ultra diluted with nanotechnology that you cannot find the molecule of that chemical. So how it can be poisonous? But still it was portrayed because everyone says, oh, arsenic is poisoning. On the contrary, the quantity of arsenic was lesser than what is being used as a food preservative. Arsenic is also been used as food preservative, but it was a lesser than that. So there is no question of poisoning. So thirdly, it was said that it is now recently what the study has been shown. The study has been shown that it is the liver toxicity. Now it's only seen on 9 patients. Nowadays we are seeing that because of the post-COVID and even because of the vaccination, so many people are going into autoimmune diseases. And we are seeing sudden increased number of heart attacks. There are neurological cases coming up. The thrombosis into the hip joint and knee hemorrhages, and all these things are coming up. And even in the NEJM, that is the New England Journal of Medicine, the article had come and it had shown the complications of vaccination. But that's a part of the science, and one should not say every science has got good effects also, bad effects also, side effects also. The controversy should not be on that, because every medicine is doing good also and bad also. But fortunately, in particularly in our homeopathy, these are so diluted, and that is what was the aim of Dr. Hahnemann. The drug toxicity should not be there. So it was converted, the drug was converted into medicine. The drug has got a molecule, but medicine is in the nano. Medicine is what is been applied to cure the disease, or to help the disease to palliate, or help the disease to be in control wherever whatever is possible. Now, particularly these nanoparticles, if they are so nanoparticles, they cannot give you side effects. And the symptoms that are proved in the proving, they are in the healthy people. So when they are not damaging the healthy people, how they can damage the unhealthy people? That is a very big question. And third, it was said that this cirrhosis of liver. Now, you know what is the amount of alcohol used? Alcohol is a vehicle. Now, once you put on the globules, it gets evaporated. And how that alcohol is going to cause liver disease? Now, it is given, there is one reference I can give you. the World Journal of Hepatology article on alcoholic liver disease. I found out that, and according to this report, cirrhosis does not develop below a lifetime alcohol consumption of 100 kg of undiluted alcohol. That is what is given in the hepatology journal. How this minute quantity can cause a, it is really not acceptable, controversial statement. And this amount corresponds to average daily intakes of 30 grams of undiluted alcohol for 10 years. This is not the case what was seen into these people, and it's such a long time. And how can you directly come to a conclusion that the homeopathic alcohol is causing a damage? It is not acceptable even to the scientific world. Some people who are against homeopathy, not all allopaths are against homeopathy. I am also an allopath. I have seen that many allopaths come to me for treatment. Many homeopaths also go to an allopath for a treatment. So there is this controversy, and this is in the certain small section of the people, and we should not bother such people, because their job is just to criticize and not to take the good part of everything. And therefore, one has to be very, very strong in what we are presenting. Now, the third thing they say, that there is no research in homeopathy. What the hell you are talking of not research in the homeopathy? You go to the website of CCRH research, ample number of research. I am being appointed as an member in the advisory research committee of the CCRH. First time I saw this, it was my first thing that I entered, and I saw so many researches done as per the allopathic standard into the standard hospital. Now, Dr. Naval Verma had with AIMS, Dr. Anil Kurana sir, sab ne milke in the AIMS, with the government lab, with the government approved lab, they have developed the nosode. If that nosode would have been supported, it was such a nicely researched nosode, and still it is lying dumb because no one wants that to come up. If that nosode is such a powerful, and it has been studied, means it was by the government approved laboratories and developed in a private NABH lab, MOLQ lab under the supervision of AIMS scientists. Now it's a government body. There cannot be any false claims for that. And it was showing the research was on a very positive side. If that would have been helped, the homeopathic nosode would have come, and then all this hue and cry that homeopathy has no base would have been stopped. But somehow the funds are not sufficient to carry out the research. People in the CCRH are doing hard work. All scientists I have seen in a very close angle, they are doing so hard work. Even in the private, people are doing hard work. Even they are developing so many things. Dr. Rajesh Shah is also developing a nosode, but everywhere he is also facing a problem that it is not allowed to come up. Now these things, on one side you say that there is no research, and other side you are suppressing the researches. Then how the homeopathy can prove? You are not allowing us to prove it. That should not be there. Means the other small researches, they have been allowed, but a bigger one. Secondly, our hospitals, where it comes in the tie-up, and I'm very happy AIMS is cooperating. There are so many allopathic hospitals are cooperating, and a majority of allopaths are not against homeopathy. That is what is my opinion, because I am also allopath. In my colleagues, I feel, yeah, 50% they oppose, 50% they don't oppose. And therefore, we should not take 5-10 people are criticizing. On the contrary, they are criticizing means homeopathy is a sign that homeopathy is emerging out as a successful way of treatment. I always say there are scope and limitation, and I always talk that good part of homeopathy, good part of allopathy should be integrated. We are here to treat the patients, to give them, not to criticize. There are so many bad things in allopathy also, so many things which are not been proved in homeopathy. Now, homeopathy is a science which I was one time a very strong opponent of homeopathy. Very strong. Means I never used to believe these small globules, what the hell they can do. But they can do good like a heaven, not a hell. Because I've seen the power itself in my own mother, who was in my own ICU. And that too, when I worked as 5 years as an intensivist, everything was checkmate position. And I was just waiting that there is nothing left out. and my mother is dying, and I was helplessly standing there. I had no choice. Then I cried in front of God and just turned my head. One homeopathic book was given. I said, I opened the homeopathic book. I said, नहीं यार ये मेरे दिमाग में जाता नहीं. This my beja was allopathic beja. So all allopaths are not wrong in not accepting, because it has been trained so hard, conventional line of treatment, that it becomes difficult to accept any other things which are not proved scientifically. This particular thing, one dose of arsenic, I would change the life of my mother. 3 days she was fine and out of the ICU. That miraculous results I have seen. Now these people, they call this anecdotal. Now I can show you minimum 10,000 anecdotal cases happening with me in my lifetime. There are so many 2 lakh homeopaths, and if you multiply, so many anecdotal cases only happen with homeopaths. There has to be something. One has to accept that, because it cannot be proved into scientific angle. There are reasons for that. Now, if one molecule which is there, we see there is a basic difference. In allopathy, one molecule has been researched to control the disease, whereas there are 50 different molecules developed into a nanoparticle control that is used for one patients, with a different nature, with a different presentation of the symptoms. So it is almost a tailor-made medicine. So in a tailor-made medicine, how can you do the double-blind control trial? That is a big practical difficulty. Now, if it is applied, now there are some mixtures which have come in homeopathy. They are there are many pharma companies given the number 27, number 24. Even they are working. How they are working, that is a big question. Now that needs to be researched, and that is getting researched. Even in homeopathy, there are a lot of resistance to acceptance of the different ideas. So science is ever evolving. It's an emerging science, and one has to be open with a broad mind to see that these things are, what is going on is right, and they should be supported. We will welcome criticism. We are open. You criticize so that we know where we lack and there we improve. And if we improve on that side, the thing will stop. The world will stop talking all what is the criticism against us in the homeopathy. Particularly, they are very small section of the people who are doing this, and ideally speaking, we should not bother for that, because even that article which was put on a social media, this is a research and homeopathy is bad, it is on the 9 patient. How can you say that it is a research? If you get it peer reviewed, it will be rejected. There is a system where it comes, whether what are the objections from the other fraternity, then everything is there. You put this into a very big journal, they would not accept it. The standard journals would not accept it. But if it is made it that no, we want to anyway prove that this is wrong. And it was done even during Dr. Hahnemann's time. Dr. Herring was planted into homeopathic circle to defame, to find out the faults in homeopathy and defame. Finally, he himself, after coming into this science, he saw this science is so great, and he became a great homeopath. The biggest book of 10 volumes is written by Dr. Herring. He was that time the eminent MD physician. So why there is a fight going on? It always makes me sad and depressed. What is this? Are we a doctor for apathy, or are we a doctor for patients? What is good? There are good in Ayurvedic science also. There are good in every science, and all other sciences should support each other. We should support allopathy. Allopathy should support us. We both should support Ayurveda. Try to find out. On the contrary, I had made a very good integrated plan way back in 2010, and I had presented to government also that all these sciences, the good part of every science has to be taken integrated, so that we get a concrete synergistic solution. It was a means whole night from 11 to morning 6 I used to write on that project, and we had submitted, but finally it was not accepted because of the funds and the research and development. I tried everything. Then I was absolutely in a silent phase when the COVID came. That time, the results of homeopathy were so rewarding, and the hands were tied. Hands were tied. You cannot give homeopathy. Just the mild cases. Mild cases, तो ऐसे भी कुछ नहीं किया तो 80% is a recovery, self-limiting disease like all viral diseases. So then you say, how can you say that homeopathy has done? And therefore, I made an attempt and daring in the cases where they were severe cases requiring ventilator, but they were not getting oxygen. And my colleagues used to tell me that if you treat, there will be action and you will put behind bars. I say I am ready to go behind bars if I am trying to save any person, because I have taken a Hippocratic oath. How can I deny a patient who is coming, is not getting help anywhere? I say, can you leave it to die? No, my dear, it cannot be. And everywhere I've presented cases in so many webinars. You see such type of, even the oxygen going to 40, just on 2 liters, 5 liters of oxygen supply, he's coming up and getting well. What more you want? This can, even if this you take it as an anecdotal case, show me one anecdotal case where it has come with no treatment from oxygen 40, it has come to 95 and patient has survived. Ventilator cases where they were not responding. Some allopathic doctors, they used to call me and say, अरे यार तुम्हारे पास कुछ है क्या होम्योपैथी में, ये मर रहा है. They were because concerned for a patient. They were not for pathy. Like I am also concerned for a patient, not for any pathy. But whatever is good, pathy, bad pathy has to be.
Now, we have got Dr. Mini Mehta with us. Now, she was not given her complete, I would say, profile. Just to share with you, or rather everybody, Dr. Mini Mehta is working in Rajiv Gandhi Cancer Hospital in Delhi. And she has not been appointed as a homeopath, but as a only as a palliative therapist. She is facing.
Kindly increase your volume, Dr. Vahi sir. Kindly increase the volume.
Volume increasing is beyond my control.
Yeah, I can hear. I can hear.
Dr. Patil is able to hear, and I think so many others as well. This latest episode, which was occurred incidentally, we were at Nagpur, coming back from a conference, then, and it's all a matter of chance that a flight got heavily delayed. And that time was the time when she told me, well, this is what has appeared today itself. Now, interesting part, Dr. Mini Mehta, actually, you may like to say something, but the good part is that Dr. Nigam, Dr. Pinakin, and they have given so many details. On that aspect, I don't know whether something you are going to add new to it, but in the video which was presented at that time, interestingly, it was her own clinic in that hospital, where the one photograph was taken that, she's dispensing medicine and so on and so forth. And I don't know how much upset she was, and she's very young, agile also. Dr. Mini, नाम ही मिनी है इसका, वैसे तो she's Betsy. Mini है, please come. What are your comments? Mini, you have to unmute. You have to unmute yourself. Amita?
Yes. Good evening,
Dr.
sir. Good
Mini, you
evening.
can unmute yourself, yeah.
Yes. Good evening, sir. Yes, I was shocked to see my picture, my clinic's picture, my homeopathic setup picture in that video. And I believe that since homeopathy has become so popular that nobody, can deny its wonderful effects. So these people have started, they have gathered and they have planned to defame it. Because हमने देखा है कि जो लोगों ने होम्योपैथी कभी यूज भी नहीं किया है, उनके भी दिमाग में अगर आप बोलो होम्योपैथी करे, अच्छा जो सेफ है, जिसका कोई साइड इफेक्ट नहीं है, दूर तक जो भी यूज कर रहा है, जो नहीं यूज कर रहा है, उसके माइंड में ये है कि इट इज वेरी सेफ एंड देयर इज नो साइड इफेक्ट, सो पीपल गो फॉर दिस पैथी वेरी इजीली. सो नाउ दे हैव जस्ट प्लान टू डिफेम इट. और ये जो है, जो लिवर डॉक के नाम से फेमस है, उसकी बातों से ही पता चलता है कि he doesn't know anything. He don't know homeopathy, he don't know anything, and he has been told to say such words so that ये defamation फैले, कि लोगों को लगे होम्योपैथी भी सेफ नहीं है, so that they should stop going towards that. So this is totally a defamation act. लेकिन since I'm working in this Rajiv Gandhi Cancer Hospital, you won't believe that nowadays they are also planning for precision medicine, which is called individualized medicine. They're doing research on it. What they're doing is they're trying to find out how different people are able to process the same chemotherapy drug in a different way. So they're working on it. So now they are finding, okay, there are 4 or 5 types of genes. This people with this kind of gene are processing this particular medicine in this way. So they are also very confused and they are unable to perform their research in their own frame, because they are slowly, unknowingly moving towards the individualized medicine, which is the truth of life. Because now they know that they cannot treat everybody under one umbrella. They have got immunotherapy now. They are, and that is also they are trying to they are trying to find out, they want to make it individualized. So the whole idea is moving towards individualized, and homeopathy is already a well-tailored individualized medicine. So it is somehow, I feel that it is very much effective as an integrative medicine along with the modern medicine. So, and I have not seen कि जितने भी learned doctors हैं, कितने भी मेडिकल ऑन्कोलॉजिस्ट हैं, दे कैन नॉट डिनाई होम्योपैथी, बिकॉज उन्होंने मुझे, इतने लोगों ने बताया कि एक डॉक्टर ने मुझे बताया कि मेरे पास एक पेशेंट आया एंड ही शोड मी कि डॉक्टर देखो ये स्टेज 4 डिजीज थी, ये मुझे डॉक्टर ने 3 महीने जीने का टाइम दिया था एंड इट्स बीन 10 years नाउ. तो वो डॉक्टर बोले कि मैंने वो देखा और बोला कि तुम इस डॉक्टर का साइन पहचानते हो क्या? उसने कहा नहीं मैं नहीं पहचानता, यहीं आया था. तो दे टोल्ड मी कि 3 महीने या 10 साल हो गए. Then that doctor told me that it was me, it was my sign, my signature, and he was following some taking alternative medicine, homeopathy. So जो लोग वर्किंग है, जो क्लिनिक कर रहे हैं, जो पेशेंट देख रहे हैं, दे आर नॉट एट ऑल इन दिस लाइन टू defame any alternative medicine. There are few people who are not so much good in clinics. Like I've been following this person from last few days, because you know I got agitated because of his bad remarks on homeopathy. He has no knowledge on anything, but why they should be bothered? Because we are not getting we are not getting disturbed by his false statements, but the people who can benefit, the innocent people who can benefit from homeopathy or integrative homeopathy and modern medicine system, they will not go for it, or they will they will have fear for it. So this should not spread. कहते हैं ना पंजाबी में हमारे एक कहावत होती है कि जमदी सूल नू ना उथे मार देना चाहिए था जहर वाली, कि अभी अगर if it is arising, you kill it there and then. तो फिर आगे ये बात होगी ही नहीं. So this is what I feel.
Okay.
That's it, sir. And sir, I have been treating a lot of people, sir, for like like recently I got a patient, her SpO2 was 61 and pulse was 122, and within a day, next day she was 86, and third day she got SpO2 95. She was able to move, stand and walk without oxygen, and they know it, they saw it. They asked me, what did you give? मैंने बोला काली कार्ब है ये. बोले पोटेशियम क्लोरेट. अच्छा, give me the data from where you are reading it. There was one doctor, he was having eczema. So I told him, if you'll suppress it, you'll get something big on your body, in your main system. And he suppressed it and he suffered heart attack. Then I after that I prescribed him according to his whole constitution calcarea carb, and he started to get benefits from it. And he was surprised कि ये 4 गोली करता है, मैं इसका टेस्ट करूंगा. मुझे बोला मिनी मेहता, I will test it, and if I'll find any steroids in it, I'll sue you. I said okay, do it. So people are acceptable also, but these bad people should be taught. We should teach them a lesson, not to say any bad things.
There is one thing that I want to add, Mini. You have told very nicely about this steroid. One dose of steroid, even in allopathy, cannot cure anyone.
Thank you.
It's a one
I'll
dose.
tell him.
The 2 times, 3 times given for so many months together, even then the disease doesn't come under control. And फिर होम्योपैथी का स्टीरॉयड कोई बहुत बड़ा होना चाहिए. It's a myth. It's a wrong thing to just to defame. A single dose of steroid cannot do anything wrong.
Dr. Daryani,
Yes.
what have you to say, sir? Dr. Daryani,
Yeah,
please.
I want to add something over here. Fortunately, we are in India. Unfortunately, our mindset is कि जब हम तरबूज भी लेते हैं ना तो तरबूज वाले पे ट्रस्ट करते हैं कि ये अंदर से मीठा होगा ना, इसमें इंजेक्शन तो नहीं डाला कोई, इसमें कुछ पेस्टिसाइड तो नहीं है। तरबूज वाले की बात मान के तो हम तरबूज ले लेते हैं। जो डॉक्टर आपको क्योर कर रहा है उससे हम 10 सवाल करते हैं कि इसमें स्टेरॉइड तो नहीं होगा या इसमें कोई ऐसा पेन किलर तो नहीं डाला जो मुझे हार्म करेगा। And I also want to add over here, and Dr. Jaswant Patil and Harsh Nigam sir can correct me, that जितना हार्म एक पैरासिटामोल करती है और पेन किलर्स करती हैं लिवर को, क्या सर होम्योपैथी करती है?
होम्योपैथी इम्पॉसिबल है करना, बिकॉज होम्योपैथी में कोई केमिकल मॉलिक्यूल्स नहीं है which causes, these drugs which go into the body, they get detoxified in the liver, and therefore liver gets affected because they are into the material doses. Paracetamol 500, अभी उसमें भी जो मिनी ने कहा ना, वो बहुत सटीक बात कही है कि जेनेटिक्स, कौन से जीन कैसे रिस्पॉन्ड करेंगे टू द ड्रग, एपिजेनेटिक्स पे आ रहे हैं अभी सब धीरे धीरे, जीन से एपिजेनेटिक्स तक, एंड स्लोली दे homeopathy is getting proved by that immunotherapy and gene therapy. So individualization will come in allopathy also. They will realize what homeopathy was talking. It was talking जैसे हमारे पहले ऋषि मुनि ने कहा कि 7 planets थे, उनके पास क्या था? Didn't have anything, but they have proved to be true. So what is being observed and by evidence is more concrete than by the science. Like rifaximin was said to be the best anti-inflammatory, anti-arthritic drug, and it was rampantly used. The joint pain patient used to dance कि अरे मेरा संधिवात चला गया, मेरे सारे जोड़े ठीक हो गए. But later on, after so many years, it was found that it causes heart attack, and so many people have got killed, and therefore it was again withdrawn from the market. So science, whereas in the evidence-based science, which was 200 years, it has not changed. It is same because it was for the welfare of the people. So one cannot criticize. There are, of course, the life support system of allopathy, we all accept it. We say yes, but why not come together and find out the right solution rather than criticizing? Help us to find out. We will do that.
I was
Daryani sir
was
कुछ बात
talking.
करना
Want to add
चाहते हैं.
something?
I was
Dr.
speaking
Daryani,
with one allopathic doctor who was a very strong opponent of homeopathy. He was speaking with me. He said, "Why you are trying to convince me, Dr. Mini? Why you are trying to convince me?" Then I said, "Sir, the person who is the biggest critic of homeopathy and trying to know it will be the best homeopath. So I want to convince you. I want you to convert." Because you are such a good doctor, you want to do good to your patients. Once you'll get to know about homeopathy, you will do wonders with it because you have already excelled allopathic medicine. He said, "Okay, let's see."
Dr. Daryani ji, please. अनम्यूट कर लीजिए, हमें तो जरा मदद कराइए.
You can unmute yourself, sir. Dr. Nishan, you can unmute. You are already given permission for unmute, sir.
Yes, now unmuted.
Daryani ji, please.
Thank you to all learned panelists, as well as audience. I will go differently. Little bit will take time. As teacher, my way is different. Hope you will bear me. Since Hahnemann's time, or origin of homeopathy, homeopathy is facing challenges. Now, The point is why? Because we failed to reply in terms of scientific language. We emphasize upon theory of vital force and dynamization or potentization, which is invisible, hence called hypothesis. Later on, called placebo. More especially, since current COVID-19 pandemic, more attacks against the system are observed. Through media and publications of so-called research papers. What could be the reason behind that? Because homeopathy system is getting popularity globally, and especially through arsenic album as immunity boosted during COVID period. I personally believe there seems to be a lobby who is feeling insecure economically. So it is creating a propaganda against homeopathy.
Thank you.
In my opinion, there are two ways to counter. Number one is media through national and international organizations. I think you will support me. Second is on the individual level. Now, what is individual level? How? That is through social media. We should avoid the circulation of such negative news. We should avoid the circulation of such negative news. No response in terms of comments or likes on such videos or blogs, etc. As you know, highlighting the more we are giving more importance. Similarly, giving negligible importance, similarly, not or less response, it means it gives a negligible response. Now, this is one part, one way, and Mini is also the example for that. I will not go in detail, Mini, sorry. Now, second way is appropriate reply by competent authority to the author of so-called research study through publisher as CCRH, MCH, drug controller, deputy drug controller, homeo, and my dear friend Dr. Pinakin is also the competent authority. And he knows so many times I approach him to take the serious response in this action on this matter. And he's doing. We should be thankful to the ministry as well as CCRH in replying justification of selection of arsenic album 30 in scientific language. To Times of India, in response to the article published titled Beware of Quacks, alternative medicine is injurious to health by Amit Verma. To news editor NDTV regarding interview against homeopathy. And many have the example before us. As I know, learned panelist has already discussed or highlighted their views in detail, so I will not go further in deep. There are two similar papers by the same authors, Arif and Flip. One is a series of homeopathy remedies related with severe drug-induced liver injury that for which Dr. Patil was highlighting their comments or giving comments. It is American Liver Disease Journal. There is second, which I will highlight. I will give my comments. Second article is of similar nature or similar language. Dangerous placebo during the COVID-19 pandemic. A series of homeopathic arsenic album induced liver injury. It is an open access article published in the journal Curious. The scientists or learned research scholars who are here, they can well imagine what is the so-called paid journals and so-called peer-reviewed journals. The following points are incoherent in the being provided with false intent. The review of the article begins on 14th June 22. Now, please take it seriously. The review of article began on 14th June 22 and ended on 15th June 22. You got my point?
22 and 15.
14th June it was undertaken for review and ended on 15th June 22 and got published on 17th June 22. Learned homeopaths can realize what is the dilemma behind. Wherein many days are being taken by the reputed homeopathy journals to review the publish the article. This shows that the article may not be reviewed properly, nor the facts has been verified. Now, arsenic album consists of 1:10 in power of 60 microgram of arsenic trioxide in its single dose, which is substantially less than the normal concentration of arsenic in rice food, which we are daily consuming. Now coming to the cases of articles. Case number 1, the patient was suffering from diabetes and NASH under conventional medicine or treatment. For the same which he is often, that we know the NASH remains silent, unaware of the conditions until the late stage of disease. It can be progressed to more serious stage disease like liver failure or cirrhosis, etc. Years of which the patient was suffering from NASH is not mentioned. This viral cause for the acute chronic liver failure were tested and claimed to be the cause of the arsenic album 30 without ruling out other superimposing bacterial infections or sepsis, etc. It indicates the bias or malintention.
I think now we should move to the next question. One interesting observation, which we have observed is generally these things come, when some important.
Dr. Wise, I'm sorry. Please listen me and give me sufficient time for putting my facts.
I thought, you had completed that. Sorry. Sorry, I couldn't understand, that part. Please continue.
I must make it clear that hair and nail sample of patient of few family members revealed high level of arsenic toxicity, but 2 members of same house who also took the prescribed doses of arsenic do not show any symptoms. One should note it seriously that 70 to 180 microgram is the dose of arsenic trioxide on which it starts to appear the hair and nail. The effect of arsenic effect, 70 to 180 microgram, sorry. Then it is possible. Homeopathic medicine, arsenic album, signifying other sources of arsenic toxicity. Now I am taking second case. The patient has taken the doses of homeopathic medicine for 32 days, which is not coherent with the doses proposed by the advisory. Hair and nail sample of arsenic analysis were not taken from the patient or the family members, without which we cannot conclude that it was arsenic toxicity.
Right.
the symptoms which patient presented after taking the arsenic album 30 were not mentioned at all. Similarly, in third case, it was state that a 48 years old overweight female developed cholestasis jaundice after taking arsenic 30 for 1 week. Causes the cholestatic jaundice like CBD, stone, biliary atresia, external compression, etc. were not ruled out. Most importantly, reference number 3, the third patient, where it is said that article that homeopathic medicine in high dilution prescribed by trained professional are probably safe, unlikely to provoke severe adverse reaction, which is ironically the claim laid down by the author that arsenic 30 has produced toxicity. Now, this is in response to COVID. There are several articles, but we should be thankful to our CCRH, who is trying to publish the paper or undertaking these studies by giving the reply to the scientific, in the scientific language as European community desires. Friends, in the field of homeopathy research, we have gone from nothing in the medicine, to there is a material and medicine. We have gone from nothing in the medicine to there is a material in the medicine. It was told hypothesis, placebo. Now it is given the shape that it contains the material and medicinal property. Several scientists are working to prove the scientificity of homeopathy medicine as well as way of action. Now today's the challenging point is how it acts. A fresh evolution of the gene regularity hypothesis explained the molecular mechanism of biological action. Dr. Patil and Dr. Mini, I want your attention. Possible role of nanoparticles. This study has done by Dr. Khuda Baksh of Kalyani University. In 2016, Dr. Jayesh Bilere, working on these nanoparticles, where he has shown the presence of medicinal particle in nano and microform in different potencies. This is a very wonderful research study. In various potencies, means potency spectrum. That was, of course, the study was limited with this limited metals and inorganic salts, especially aurum metallicum, argentum metallicum, and natrum mure, as well as on kali mure. In 36C, 30C, 200C, and 1MC, 1M potency. Working on the, due to some eye problem, I am not able to focus
So
myself.
please take your time if you are getting distracted. You
Sir,
can
let's
please
really
hold
get it,
for
sir.
some time and we can take some other speaker for some time.
I couldn't understand you.
Sir, I'm saying if you want some rest, we can give you rest for 2 minutes.
No. I will go through. I will sum up within 10 minutes.
Actually, there are more questions also. So eyes
As
correct.
we know, the particle size which is less than 100 nanometer ranges is called nanoparticle. Similarly, Dr. Papaya Nandi, in her study, potentization, its effect on biological and physical system. There are series of these studies. Antiviral and anti-inflammatory activities of novel belladonna formula against Japanese encephalitis via inhibition of P65 nuclear and other parameters, other tools, using other tools. Dr. Shailendra Saxena is an assistant dean in Lucknow Medical College, King George Medical College. CCRH taking the help of these scientists. There are a number of scientists. Professor Upma Agdi, Department of Zoology, Punjab University, stimulation of immune response by homeopathic remedy. Now, recently, I will not go in detail, but recently our youngsters are coming up. Dr. Nilanjana, who is pursuing PhD,
Dr. Vai sir, I think there is some audio problem with Dr. Daryani sir. Can you please take over?
I mean, I'm not able to hear him. Anyhow, so what I can do is, in fact, my work has been made more simpler because something and topic which I wanted to take later on, they have been covered to a good extent. Only ask for the time being, Dr. Pinakin. Has some response gone from the MCH or PCRH, in case it is in your knowledge, about such mispropaganda? Dr. Pinakin, sir.
Yeah.
Mhm.
Exactly. Ministry of Ayush is also much active.
Mhm.
There are many public grievances received by PMO and Ministry of Ayush regarding this.
Mhm.
And even we are behind the Wikipedia's these definitions of homeopathy and descriptions of homeopathy. There are many things mentioned in Wikipedia about homeopathy. Uh, Many things are objectionable. So on that also, the working along with CCRH, Ministry of Ayush and NCH, we are going on. So there shall be some solution.
Mhm.
Exactly, I would like to say here that the highest authority
Mhm.
in this medical commission, National Medical Commission, as NCH is, I met his chairperson. He has very high regards. He is from Jaipur, Suresh Chandra Sharma. He is ENT surgeon and he is the chairman of NMC. And his colleague, one neurosurgeon in Jaipur, is converted totally to homeopathy practice. And he actually, without appointment, we went there in NMC. But immediately gave us an appointment, and we were sit together just discussing about the best and qualitative part of homeopathy. And I was very happy to hear from his mouth the homeopathy, the miracles of homeopathy done by his colleague, some neurologist in Jaipur. So he has very high regards for homeopathy. There are many of the things where we can collectively, actually, we should construct some base, sound base, with help of our homeopathy, all the institutions, as well as those who are supporting us from other side, other pathies. So I think there will be something will come out after this much efforts, and I think everybody is very active. The all you all seniors are also having very good this material, this logic research, and CCRH is with us. uh, we are having some problem with Kerala, that also we have taken step immediately. And the Kerala State Council has actually, he was a homeopath criticizing homeopathy. So we were able to take a immediate step against him, and Kerala Council has rather cancelled his registration for the period of 1 year. But that is immaterial, rather. But the tendency of criticizing homeopathy and this producing a propaganda against homeopathy shall be only met with a qualitative practice and the inherence of our Hahnemanian legacy. And you all are senior one, so everybody is working together in this direction. So we should not worry what will happen, but we should able to support all the activities which built up more and more faith of people or public in homeopathy. So NCH, whatever any complaint or any grievances are received or anything we are receiving from even social media, we are taking action against that. We are putting it on the files, whatever is it, and we react by the even a piece of paper or few lines on the paper, but it is reacted all the time, and so nobody is reacting. It is not like that. Everybody is reacting, and NCH is also reacting, and whatever. But the those practitioners who are not registered with our pathy, there our we cannot control them. So we are writing to their councils about this Kerala issue. The Kerala Medical Councils has issued a notice to their allopathic physician, and he is called upon, he is booked by this Medical Council of Kerala. 5th was the date, this today was the date he was called for the some, he was given a notice by Medical Council and he was called for some clarification, but he didn't turn today, and he was able to get some stay against the Kerala Medical Council. So the things are going on. We are behind that. Just day before yesterday, I had a talk with our homeopathic registrar of the Kerala, and he gave me information about this. So everything, everywhere, whatever NCH can do the things, can do in the this rather we have to work accordingly, the provisions of the regulations and provisions in the laws. So we are doing our best. We are directing the concerned authorities, or we are even writing to NMC for this. We had a meeting, joint meeting with NMC, this NCISM, Indian System of Medicine, and NCH together. But at that time, this type of issue was not on the surface. But in next meeting, we are thinking to put such type of issues for the discussion in the joint meeting of all the three commissions. So even their commissions, they can have some regulation that criticism of a different pathy uh, may be restricted by some adding regulation to the ethics and this code of ethics of a National Medical Commission. So we will try for that also, and that thought process is going on in our authorities' mind. That I met Dr. Rakesh Sharma. He is a this chairman, as a president of Board of Ethics and Registration in Ayurveda. He was also having such mentality that combinedly together all three commission shall put something in their regulation that homeopath shall not criticize allopathy, allopath shall not criticize homeopathy. So such a allopathic community shall also aware that they shall not criticize any pathy directly. So that can be a part of regulation in future. We are hopeful for that also.
Thank you, Dr. Pinakin. We have a small query from Dr. Indrajit Nanda. Dr. Nanda, you can unmute yourself. And after that, we will take from Dr. Harsh Nigam, sir. They have raised their hands. Dr. Indrajit Nanda, you can unmute yourself. The permission for unmute has been granted, Dr. Nanda. Dr. Harsh, sir, you can take over.
Yes, so we have been talking about different things today, and our learned and experienced panelists have given their views. But I would like to sum up everything into 5 major points. how to respond to such trolls and such negative publicity. Now, all the doctors who are on social media, they must be congratulated because they are on social media. And if you don't have a YouTube channel, please do have a YouTube channel. Because I have a YouTube channel, Dr. Amrita has a YouTube channel. With each channel, you would have certain followers. Like I have 10,000 followers now. In 5 years, I'll be having 1 lakh followers. Now, this is called as butterfly effect. Since we are going to have small YouTube channels where we can portray the positive side of homeopathy. See, trolls would always be there. Trolls are going to increase. Negative publicity is going to increase. That is the writing on the wall. You would have to be prepared what to do. Now, all the youngsters and all the people who are doing positive work in homeopathy, they must consider these 5 things. One is that do not divert blame. If somebody is blaming you, if somebody is pointing a finger at you, then you must not get defensive. Don't divert. Respond quickly. These are 3 important things to do. Fourth is that you must respond with a solution. Do not respond with an answer or do not respond with a question. Do not try to belittle somebody who is questioning you. Be respectful to them, but you must have a solution at hand. And I'm going to give you a very positive solution that International Homeopathic Federation can think about. Please make an evidence pool of all the anecdotal evidences that you can gather from practitioners who have been working. Like Dr. Patil sir, Dr. Daryani sir, Dr. Pinakin sir, and all you people must be having hundreds of evidences, so-called anecdotal evidences. Please collect a pool under one head so that somebody who's questioning you about the results, they can be diverted to that website. Please go and check the results. Even we as practitioners, if somebody is trying to say whether, especially the young practitioners, they are often asked by their patients, have you ever cured a case of, say, gallstone or a renal stone or anything? So he or she can also direct the patient to that website. You go and check that homeopathy works here, and we have evidences. So this evidence pool is very important. Radar people, they have developed a system called as Cliffy-Call, wherein they are collecting clinical evidences worldwide. While India is a laboratory of homeopathy, we have been the most successful nation with homeopathy. We have thousands of practitioners with excellent evidence with themselves. We must collect that. If we can collect, say, in every clinical scenario, if we can collect more than 100 anecdotal cases, and we have that in one pool, I think you can answer very positively to the trolls that that is the way homeopathy gives results. Coming to the question of whether homeopathy works by this way or that way, science is going to prove it somehow, either today or tomorrow or after 10 years. So that is a question that is to be left, because the answer is simple. Even in allopathic pharmacy, if somebody, if you ask somebody what is the mode of action of alprazolam, so the mode of action is yet not clear. Diazepam, mode of action is yet not clear. So ठीक है, mode of action is not clear, but the result speaks for themselves. So we would have to be prepared to create an evidence pool under one organization or under CCRH, whatever might be the best way to go about it. That is what is my humble submission.
Thank you,
Very
Dr.
well,
Harsh.
sir.
Dr.
It's also
Indrajit,
nice
sir,
of you.
are you able
Very
to
well.
answer, sir?
हाँ नामिनी कुछ कह रहे आपने अमिता कुछ
I
कह
said
रही
very well, sir. Very well, sir.
Very much.
Very well. Thank you.
no actually I
Yeah.
agree with Dr. Patil when said when so much criticism comes, that means you are gaining popularity. So
Yes,
that is something which is always there. And again, so far as the media part is concerned, national media so called, this time it was a lot of hue and cry because inside the the channel where from it came, that was more or less like a national media. Now, there is one irony. Negative news it always spreads much faster than the any positive or the development news. That's the ground reality, and I think all of us we have to accept that part. The good part of whatever discussion has taken place so far is most of the questions which I have prepared, automatically things have moved in that direction, and I've got the answer, so no more wasted on that time. But one question, is very important for me. I think Dr. Pinakin and likewise Dr. Harsh Nigam, he has done a lot of research on Hahnemann itself. डॉक्टर हेल के बाद में अगर कम काम अगर किसी का रियली एक कंक्रीट शॉर्ट में लगा तो आपने जो सीक्रेट लाइफ ऑफ हनीमैन लिया है वो बहुत रेलेवेंट है और बहुत शॉर्ट में है. तो यहाँ पर मेरे क्वेश्चन आता है, दिस इज मोर रिलेटेड विद द नेशनल कमीशन फॉर होम्योपैथी. Do you feel that history of medicine and that of homeopathy should find more space in our curriculum at the undergraduate level? Now, why I'm telling that part is that generally what we have observed is कि वो थोड़ा बहुत हनीमैन के बारे में एग्जाम के पास होने तक या वाइवा के क्वेश्चन में जवाब दिया वहां तक, उसके बाद में खत्म हो जाता है. Most of us, we have not bothered to read the what sort of answers or the torture Dr. Hahnemann had to face. ये चीज जब तक हम लोग इसको सैनिटाइज नहीं करेंगे अपनी यंगर जनरेशन को, तब तक उनमें इस चीज की इंपॉर्टेंस कहाँ से आएगी. Another example of is that of Dr. Hemmer. Hemmer was never a homeopath. He was himself an oncologist, and if you go through his history, you find he also had to face enough torture, even imprisonment, for all the research work which he did. And what we find is that all his work, it shows positivity towards understanding homeopathy. He did not use the word homeopathy, but then Dr. Heyman, so-called the German new remedies, what he has mentioned, the topic is really wonderful, and he has been imprisoned for that. He has faced a lot of torture. So do you feel that history of homeopathy in relation to history of medicine has to find much more space in our curriculums? Dr. Pinakin.
Yeah, it is already there. This new curriculum, I'm not actually looking after the education board, but in the discussion I came to know that the hours which are defined to study the this life and literature of this Dr. Hahnemann is, I think, increased more than the earlier syllabus. And for post-graduation student also, I think it is still not published. It is not still gazetted, but it is put on the website of NCH. For postgraduate study also, this Dr. Hahnemann and even all our homeopaths, those who have worked for homeopathy, which is considered and was put for further study for postgraduates also. So even if we are getting more suggestions from this community, that can be considered, because still the postgraduate syllabus is rather not published in Gazette. So it is even there is a scope of adding something more in that. UG syllabus is finalized and is now it is in a form of regulation, but it is containing very good portion of what you have suggested, Dr. Vahi.
So nice of you. So I think most of the things which you wanted to discuss, they have been covered. Dr. Indrajit.
Yeah. Am I audible?
Yes,
Am
you're
I
audible.
audible?
Yes, you're audible, Dr. Nanda.
Yeah. So this was more of a suggestion than a query. Actually, what I do when I go to any public meetings like Lions Club, Rotary, so I normally carry a small kit to be distributed freely. Homeopathic education goes a long way in educating general public as well as our patients to start replacing some common things like medicine for fevers, for simple headaches, for acidity, by replacing that with homeopathic medicine. So I've started distributing kits and have got a very favorable response. And also when you give the kits, naturally questions start arising that like the things like it is safe or not, or how we can use it. So like some might also disagree because it leads to self-medication, but you know, self-medication goes on in allopathy as well. So with replacing homeopathy at home for simple emergencies is a good way of educating and also going in public. Like we should be very actively involved in when reaching to associations like Alliance and Rotary and other things, where we can easily propagate homeopathy in a very big way. That's my humble submission.
Yeah. I'd like to say something here also. The regulation of Code of Ethics has published, and we have first time we have introduced the guidelines of good clinical practice for our practitioner to that regulations. All the colleges were given, all the principals were given a book free of cost by NCH, which is published by CCRH about the guidelines of this good clinical medical practice. And also on this third, 2 days back, we had a meeting of all the registrars of the state bodies in Delhi. And there also we have given the book, that book in the kit. I think the some common type of practice by this giving this book, if can be developed among the homeopaths, or we cannot say exactly a very synchronized or very common, but something in the common pool. And one more thing I would like to say here, that CCRH has already some area for the practitioners about their case study, and their if they provide their case study to the CCRH website, they are keeping the data on their website to study, and that's a collection of very good this case studies. So that can also be put practiced by our practitioners regularly. So every practitioner shall get registration there on the CCRH website and shall give their case studies in the format. It is a common format which is prepared by CCRH, and there are many number of case studies are coming now gradually. So that can also be recommended to our practitioners, those who are having very good practice, and that will be rather useful for the young practitioners, and that will create a positive, rather phenomenal improvement in the practice also.
Precisely.
So
Yeah.
that can also be fought for.
I think we are already we are going much beyond time which was presumed, which was dedicated. Anyhow, so before we finally say goodbye, I would like to ask each of the panelists, just in very small words, if we had what they have to say. Anyway, very few lines for a minute to each person. Dr. Nigam, sir.
Thank you, sir. As I said before, we must unite and collect evidence pool so that we can give answers to all the queries firmly and without diverting blame. I think that would be the best way to go forward. Thank you.
Correct. Dr. Patil ji?
The best solution would be what people are talking is talking about the research that has been done, every article to be discussed and publicized on the public media after it has been open for public to read that. And that would give a very good impact because all people in the scientific world understand only the language of research. And we have to prove that, like simple article, which was not even good, has caused so much of havoc, and we are sitting for a meeting here. So our real research, if it is put in public forum, it will give us more locus standi. Thank you.
Dr. Mini?
Sir, I agree with my seniors, whatever they said.
Dr. Daryani ji? Dr. Daryani ji? Coming up of today's discussion, what are your comments? Now, you are not audible. Please.
Dr.
Please
Nigam
unmute
has
yourself.
given a beautiful message,
Ah.
and I agree with him, and I'm with him. But my point is, कोई थप्पड़ मारे उसका जवाब न दो, कह दो दूसरा भी गाल यूं कर दो. I don't believe in this theory.
इश्यूज के दोनों ही आंसर होते हैं, पॉजिटिव भी नेगेटिव भी. एक अप्लाई
Whatever it may be, whatever it may be. But my point is, we should strongly oppose the lobby which is creating this type of nonsense.
Yes, sir.
जो दिखता है वो बिकता है. So make homeopathy more visible.
Yes, Dr. Nandan.
Again, the same point, theory of vital force and dynamization. It is invisible.
What we could learn.
Therefore, it is known as hypothesis. We should not be a hypothesis follower. We should be follower of scientificity. And sir, in this scientificity, my points which I put before the house or before the learned panelist, it was purely with the scientific base. At least I am sure for that. Dr. Nigam will support me. That is something different because he has got different idea.
But sir, I'm 100% with you when you are. In fact, I was thinking that you must be made a brand ambassador for all the research papers that are negative, so that you can give an answer to those.
I'm thankful
Because
to you
it was such a learned response to that paper that this should be on public domain, especially vis-a-vis this paper and future negative papers.
I agree with Dr. Harsh. Daryani sir has given a very scientific explanation answer.
Yes, sir. And it should be circulated. Actually, this should be circulated.
Yes.
Dr. White will remember that once I discussed with you that this propaganda is going on, what could be the solution or what could be the counter? Then he said, have you seen the video? I said, not seriously. There is one video who's the lady who's dispensing the medicine, you just recognize her. And that lady who was dispensing the medicine, it was Dr. Mini.
The secret superstar in mask.
Mini, you still have a chance. You can take a royalty from that
international media gave her or highlighted her. We have several sittings with her. I'm very proud of this girl at this age and these circumstances, family foundation, etc. She is doing good, not good, but super.
I agree with you.
And I must say, few people in my hospital saw that video and they were, they were commenting on it. But Dr. Daryani, he has guided me so well. What was there in the paper, that I was able to answer so smartly and react so smartly on that everybody stopped it. And they had to read that paper and they said this is no research. And sir is such a dedicated homeopath. His soul is dedicated to homeopathy that he, number of times we spoke on this topic. He can't spare people who are taking homeopathy in a negative way. He can't, at least. So so message is, we can't, take it lightly. Light or no reaction towards the people who are trying to defame it or trying to prove it only a placebo.
Absolutely.
Dr. Pinakin is here. He must be knowing that how many times I approach him for certain things. You do this thing, you give reply like this. Am I correct or wrong, sir?
Yeah, sure, sir. And
And
many of the times we are also taking help of
everyone. I'm reachable to everyone because of my integrity.
Definitely.
Day before yesterday, I was talking with the drug controller Homeo. I asked her what kind of duties you are performing, what type of complaints you will entertain. At least at this age, I have reached at that level that I can speak frankly, giving my introduction, my name. They say, sir, you are welcome. Really, today we are happy to talk with you.
Sir, you have
Dr. Nigam,
contributed a lot to homeopathy.
Dr. Nigam, sir, he knows my teaching, how I teach. Today, my language, my flow, the way of starting the lecture or the talk was entirely different than what you people have given this. I'm not going to criticize anyone because I start from very beginning and then go on the up. I never touch the sky. I start with the earth.
Anyhow, I think we should be grateful to the to such a beginning that they have raised.
I'm sorry, Dr. Why I interrupt you. You are most senior person, and I should not say anything, but you have regard for me and myself. I have also high regards for you.
So nice of you, sir.
What I could होता है, शिव राम के भक्त थे और राम शिव के भक्त थे.
देखिए, today in case I am able to sum up is that the two important things, that particular video and coming on a platform which was more related to a national media, उसने हम सबको जगा दिया है और सबको इकट्ठे एक प्लेटफॉर्म पे ला करके खड़ा कर दिया. तो इससे अच्छी क्या बात है? So as Dr. Jaswant Patil says, we should be thankful to that media report. We should really be thankful. Another thing, what Dr. Pinakin has revealed is that हम लोग ये नहीं कह सकते कि साहब कि मिनिस्ट्री क्या कर रही है. No, they are already very active on that part. रिस्पॉन्स जो है वो एक इंस्टीट्यूशन की तरफ से जाना अलग बात है, इंडिविजुअल्स की तरफ से जाना दूसरी बात है. एंड कमिंग फ्रॉम एन इंस्टीट्यूशन एंड देन अगेन मैं तो प्लान किया था कि क्या लीगल रेमेडीज क्या हो सकती है इसके लिए. एंड आई एम रियली हैप्पी टू नोट दैट NCH इज ऑलरेडी एक्टिव ऑन दैट पार्ट ऑल्सो. अभी तुम सिस्टम की कोई बुराई नहीं करोगे लिमिटेशन सबके साथ है रहेंगी, बट एक दूसरे को ऐसे कंडेम करना जो है गलत। तो ये जो मीडिया नेशनल मीडिया का पॉजिटिव न्यूज नहीं आती है, नेगेटिव न्यूज से उनकी टीआरपी बढ़ती है।
Sir, we have a query from, I think, Dr. Brijbhushan. He has raised hand.
डॉक्टर ब्रिजभूषण कहता, मैंने कहा था एक बार की बात करने।
Yeah, am I audible?
Yes, sir.
Yes, yes, you are audible.
See, firstly, by regards to all the doctors here, especially Dr. J.D.Daryani, I am very encouraged by his words that you cannot offer another side of your face for another slap from somebody else. I have a suggestion here to all the panelists and all the people who are here, that we should have a scientific as well as a legal cell in homeopathy who can give out those answers in the same order as they are received from the other side. The aim is not to fight with the other side. The aim is to let them know that we have done a lot of scientific research in this field and we have come a long way. It is not a short time that homeopathy is spent. Actually, what has happened in this country is that since the onset of the Department of Ayush, everybody from the other system is rattled as to what may be their challenge and competition for the future times. And all the people, even the converts from the other system, know that how homeopathy has excelled in the past as well as the present days. And it is not just a system of symptoms, it is a system of scientific evaluation step by step of so many disorders which are not even approachable by the other system. So my request and suggestion to the panel and all the senior doctors here is that we should have a cell of homeopathic doctors, national cell, who are able to give those answers in the same order as you receive from the other side. Thank you.
So I think Dr. Mehta.
Yes, sir. Pardon me, sir. My camera is actually not working. I think there is some technical fault.
चलो कोई बात नहीं, शक्ल तो देख ली थी आपकी।
Yes, sir.
सबने देख ली है शक्ल, कोई दिक्कत नहीं है। चलो, I think now it's time that we should wind up and you give your closing remarks.
Yes, sir. First of all, thank you all the expert panelists for your time, because this was very important and your presence made it totally different. And Dr. Daryani sir, आपके patience की, आपके guidance,
Dr. Rumjul Singh had raised the hand. Dr. Rumjul Singh, you wanted to say something? No, I think she said.
So, Dr. Thank you so much. आपका है कि आप इस एज में भी, इस एज में हम लोगों से बहुत एक्टिव हैं आप, एंड जिस तरीके से आपने केस बाय केस आप प्रेजेंट कर रहे थे चीजें, तो वो एक बहुत क्लैरिटी के साथ जा रहा था सेशन. But we also had limitation of time. Otherwise, we should have pulled it more. Dr. Patil, Dr. Harsh sir, Dr. Pinakin, Dr. Mini Mehta, आप सबने जो अपने inputs दिए हैं, Dr. Nanda की suggestions, Dr. Brijbhushan की suggestions, I think IHF has to do lot of groundwork अभी. And आप सब seniors के साथ, Dr. Wahi, Dr. Muktinder Singh, जितना मैं कर सकती हूँ और जितना मेरी कोशिश होगी इस चीज को आगे तक ले जाना, और जब तक हम उस लेवल तक पहुंच नहीं जाते कि यस होम्योपैथी जो डिजर्व करता है और उसको जो एक रिगार्ड रिस्पेक्ट हमारी सोसाइटी में तो मिल ही रही है, लेकिन हर फील्ड में एक उसकी अलग रिस्पेक्ट बनना बहुत जरूरी है. इट शुड नॉट बी ट्रीटेड अ साइंस, अ स्यूडो साइंस, अ फेक साइंस, कोई भी उसको आके डिफेम कर दे. एंड एज डॉक्टर दरियानी सर सेड कि अब टाइम नहीं है कि कोई एक गाल पे चाटा मारे तो आप दूसरा गाल आगे कर दो. हाँ ठीक है, उसको चाटा मारने की भी जरूरत नहीं है हमें, लेकिन जवाब देना बहुत जरूरी है. बिकॉज साइलेंस should not be treated as your weakness. if it is your strength, it should be shown as a strength. So चुप रहने का टाइम अब आई थिंक खत्म हो गया. एंड डॉक्टर पिनाकिन सर, वी थिंक दैट कि आपकी लीडरशिप में, क्योंकि आपकी जो प्रेसिडेंटशिप की पोस्ट है बोर्ड ऑफ एथिक्स में, उसमें हमें बहुत चेंजेस देखने को मिलेंगे, क्योंकि आप ही ये कर सकते हैं. एक रेगुलेटरी अथॉरिटी के साथ हमारी जितनी हेल्प चाहिए होगी, IHF की, सब डॉक्टर्स की, वी आर देयर. बट सर, वी नीड योर इमीडिएट एक्शंस ऑन दिस, बिकॉज आप करेंगे, हम साथ साथ आपके पीछे फॉलो करेंगे.
Well, one thing I would like to share here.
Yes, sir.
My backbone support is Dr. Nishant.
Oh, wow.
Because at this age, I'm not able to write or not able to sign or not able to type. My thought process to write in language, without him, I'm incomplete. So my sincere thanks to my lovely Nishant.
Thank you, Dr. Nishant.
Thank you,
for
Dr.
taking your time out, and आपकी वजह से डॉक्टर दरयानी सर हमारे साथ जुड़ सकते हैं और सब चीजें प्रेजेंट कर सकते हैं. सो थैंक यू सो मच फॉर योर टाइम.
Always my pleasure.
अमिता, मुझे एक ही चीज की ऑब्जेक्शन है.
हाँ जी सर.
ऑब्जेक्शन वहां पर होता है जैसे आपने दरयानी जी को बोला कि एट दिस एज यू आर डूइंग दैट थिंग. यानी आप कुछ भी करो, लेकिन हमको एज याद मत दिलाओ.
नहीं, मैंने इसीलिए पहले ही बोला कि मुझे नहीं बोलना चाहिए. बट मतलब सर की एक सीनियरिटी जो है, आई शुड से सीनियरिटी, वो उसका बहुत बड़ा रिगार्ड है, रिस्पेक्ट है. एंड सेम गोज फॉर यू सर.
If I say one comment for Dr. by sir, I am inspired from him, because at this young age, he always looks fresh and cheerful.
Yes, sir. Yes, sir.
And making naughty jokes. Naughty smart.
यही राज है उस चीज का, और कुछ नहीं है.
अरे दिल से जिंदा है तो हम हैं. अगर दिल से मरे हुए हैं तो हम क्या हैं?
कुछ भी नहीं.
डॉक्टर निगम सर.
सर आप दोनों ने सारी थकान उतार ली पूरे दिन की.
आपस में.
डॉक्टर पाटिल, you must be remembering the scene of WHD. I never allow any person to give slap on the second. Never allow anyone.
सर फर्स्ट में भी मत दो सर.
WHD में आपने बहुत अच्छा काम किया था उस टाइम में. मालूम है, मैं आपकी वजह से इतनी देर तक.
Now,
आपकी हिम्मत और स्ट्रेंथ हमने देख ली तो हमने सोचा कि ताकत हो और हिम्मत हो और सहारा हो तो JD Daryani सर जैसा.
my backbone is Dr. Nishant.
God bless.
He's always with me like a shadow.
He's doing a great job. He's doing a very great job.
डॉक्टर दरयानी सर, आपकी ब्लेसिंग्स के लिए भी थैंक यू. आप कॉल करके जो सजेशंस और गाइडेंस हमें देते हैं वो बहुत काम आती हैं, और वी ट्राई टू वर्क एज यू से. सो थैंक यू सो मच फॉर दैट एज वेल.
एंड
Dr. Nigam, if you don't mind,
Yes,
mind,
Yes, sir.
what kind of personality you will label me?
Sir, you are pure sulfur of the highest order.
No, that is not. I mean, what type of personality I am?
Sir,
Because you can judge from both sides.
Sir, you are sanguine in temperament.
Sanguine, yes. Yes, sir, you are correct observer.
Thank you, sir.
You are correct observer. Now,
what
about Dr. Wise? What about Dr. Wise?
नहीं, मैं और बात
Dr. Wise,
आपने भी
Dr. Wise sir is also
डॉक्टर
sanguine, sir.
पूछा आपने कि भाई इन केस यू डोंट माइंड, अगर मेरे को कहा होता है ना तो मैं बोलता कि आई डोंट हैव द माइंड टू माइंड इट,
Hey,
Sir, I
that's
don't.
your greatness, sir. But now about Dr. Y,
There is also sanguine.
it means similarities are here. And
Yes, sir.
same,
Bilkul.
if I speak little about you, I think you are my respectable person.
No, sir. No, sir. आप पब्लिकली क्यों मुझको
You
शर्मिंदा कर रहे
deserve
हैं?
all. You deserve all.
It's your greatest that you are showering your blessings to me.
Sir, you are down to earth, but you never show yourself as you are in high position. Thank you very much. Thank you.
Thank you.
Thank you, sir. Thank you. Thank you, everyone, for your time, for your patience.
Good night, everybody. And सारे
There
बड़ों
is
को
a
प्रणाम.
suggestion.
Pinakin sir को, हवाई sir को, पाटिल sir को,
Namaskar.
सबको प्रणाम.
Malhotra,
Dr.
Bhavna,
Bhavna Malhotra.
Bhavna, how are you?
Dr.
Ever
Bhavna, you can
smiling,
unmute
ever
yourself.
smiling and cheerful. Ever
भावना
smiling
को
and
किसी ने नहीं
cheerful.
बोलने दिया आज.
Thank you, sir. Thank you, sir.
बट हमारे लिए आपके सबके मन में आपके लिए भावना बहुत अच्छी है.
भावना को ही समझना चाहिए सर, सबको सबको एक दूसरे की भावना को समझना चाहिए.
बिल्कुल बिल्कुल.
मैं सबकी भावना का कदर करता हूँ. और आपकी भावना, मेरी भावना का भी. Okay, sir. Thank you.
Thank you so
Goodbye.
much for your time.
So,
On
Bye.
behalf of
Bye.
International Homeopathic Foundation, I thank you,
so much.
everyone. And
Right. Thank you
we'll be
so much.
connecting again some other day with some other good topic. So thank you so much for your time and patience. Thank you, sir.
Bye bye. Thank you.
Thank you.
Okay. Bye bye.
Can I end the meeting now, sir?
Yes, you can.
Thank you. Thank you.